Florida isn't just a state, it's a time machine for American healthcare. The challenges your state will face in 10 years, we're solving them right here, right now. From our massive senior population to the explosion of new health technology, Florida has become the epicenter of medical innovation. I'm the founder of Palm Health, Jacksonville's premier direct primary care practice, and Florida's first AI-centric clinic. We're not just watching these trends, we are on the front lines creating them. Today, we're giving you an insider's look at the future of your health, happening right here in the Sunshine State. The Florida Health Equation. What makes Florida the perfect storm for health innovation? It starts with our population. We're home to over 22 million people, and nearly 1 in 5 of us is over 65. That demographic reality forces us to innovate. The old reactive model of sick care is failing our seniors and our families. We have to build a system focused on proactive, preventive health. Add in our incredible diversity and a culture that embraces wellness, and you have a living laboratory for the future of medicine. Senior Care 2.0, from nursing home to smart home. The old vision of senior care was about managing decline. The future, which we are building at Palm Health, is about extending vitality. We're seeing a shift from crisis-driven hospital visits to proactive, at-home monitoring. AI-driven platforms can track vitals from wearable devices, flagging potential issues before they become emergencies. Telehealth, a core part of our direct primary care model, allows seniors to manage chronic conditions from the comfort of their home. It's about using technology to empower independence and dignity. Telehealth isn't a backup plan. It's the new standard. For many clinics, telehealth was a temporary fix during the pandemic. For us, it's a fundamental tool for better care. In a state as vast as Florida, your access to a great doctor shouldn't depend on your zip code. Our members text, call, and video chat directly with their physician. Need a quick consultation or a prescription refill? It's a text away. This is healthcare that fits your life, not the other way around. The Jacksonville solution. How we embody these trends. It's one thing to talk about these trends. It's another to put them into practice. Here in Jacksonville, we've built a clinic that represents the future of Florida healthcare. As Florida's first AI-centric clinic, we integrate your lab data, wearable stats, and medical history to get a proactive, predictive view of your health. Our platform helps us see connections that are often missed in the traditional system. We tackle the access problem head-on with the direct primary care DPC model. We've eliminated the insurance bureaucracy. Our members pay a flat monthly fee for unlimited direct access to their doctor. This means longer appointments, no surprise bills, and a real, trusting relationship with the person guiding your health. And as a veteran-owned practice in a city with a huge military community, we have a deep understanding of the unique health challenges our service members, veterans, and their families face. Mental health awareness and challenges. Yet not all trends are positive. Mental health remains one of Florida's most pressing challenges. Demand for counseling and therapy has surged, especially among younger populations, but access to qualified professionals remains uneven. Rural areas in particular struggle to provide adequate resources. At the same time, the stigma surrounding mental health is beginning to fade, with schools, workplaces, and community groups taking a more active role in promoting awareness. Digital platforms are also helping bridge the gap, connecting patients to therapists virtually. Still, the state faces rising levels of anxiety, depression, and substance use, issues that demand systemic solutions. Florida's challenges, modern solutions. Let's be clear. Florida faces real health hurdles. Rates of diabetes, hypertension, and heart disease are among the highest in the nation, driven by a combination of lifestyle factors, limited preventive care, and an aging population. On top of that, mental health resources are stretched thin, leaving many Floridians without adequate support in times of stress, anxiety, or depression. These issues aren't just numbers on a chart. They translate into lost productivity, higher medical costs, and reduced quality of life for families across the state. But here's the truth. These challenges are often symptoms of a broken system. The rise in chronic disease isn't a reflection of patients making poor choices. It's the predictable outcome of a healthcare model that prioritizes quick fixes over long-term solutions. When most people only get a rushed, 10-minute appointment, there's simply no opportunity to explore the complex interplay of diet, stress, sleep, and environment that drives health outcomes. Instead, the default becomes writing another prescription and sending patients on their way. That's exactly the gap Direct Primary Care (DPC) was created to fill. By removing the red tape of insurance-driven medicine, DPC allows physicians to spend real time with their patients, time to listen, to ask the right questions, and to build trust. Instead of treating symptoms in isolation, providers can address root causes. Conversations about nutrition, exercise, stress management, and sleep hygiene aren't extras. They become central to the care plan. This model also allows for continuity and accessibility that the traditional system often fails to deliver. Patients can reach out directly to their doctor by text, phone, or telehealth, rather than waiting weeks for an appointment. Small, proactive adjustments can be made before a condition spirals into a hospital visit. Over time, this kind of consistent, preventive approach has the power to not just manage chronic disease, but reduce its prevalence entirely. For a state like Florida, where chronic illness, mental health struggles, and limited access to care collide, the DPC model represents more than a new option. It's a modern solution to an outdated problem. By shifting the focus from reaction to prevention, DPC has the potential to transform not only individual patient outcomes, but the overall health of entire communities. The future is here. The future of healthcare isn't a mystery. It's being written right here in Florida. It's proactive, it's personalized, it's data-driven, and most importantly, it's built on a real relationship between you and your doctor. Florida's story shows that we don't have to accept a system that's failing us. The challenges are real, but the solutions are here. If you're tired of the old, broken model and ready to experience the future of medicine today, you're in the right place.